Okay, moving on to oncology word roots. So these are word roots that involve cancer. Of course, oncology, the study of cancer or tumors. Just keep that in mind. We'll get to it on onco. Anyway, let's begin. Blasto, like a blastoma or an osteoblast. What does blasto refer to? Now, let's talk about osteoblasts. So osteo, again, means bone, right? So what do osteoblasts do? Kind of the opposite of what you'd think with the name of blast, right? So osteoblasts build bone tissue. They will divide into bone cells, and those divide, and those divide, and those divide until you have a bone that has been built, right? Blastoma is a type of malignant cancer that involves a specific type of cells. Okay, so blasto means germ cell. So when we talk about osteoblasts, these are germ cells that will build a tissue. Blastoma is a type of malignant cancer that affects what are called precursor cells in kids and infants, because precursor cells are cells that can turn into any other kind of cell as the fetus is developing. So that type of cancer would affect, many different types of cells, and it could affect lots of different structures in the body because it starts to spread before the cells have decided, what kind of cell am I? So blastoma affects the germ cells, right? It's a tumor of the germ cells that will divide and form the entire organism, right? So blasto means germ cell. Okay, moving on. Carcino, like carcinoma or carcinogen. What is a carcinogen? Now we've heard the term carcinogens before. Carcinogens are things that produce. Gen means produce. Produce what? Like cigarette smoke, asbestos, carcinogens. What are these? What do these produce? They're known to produce cancer, right? So carcinoma is a cancerous tumor. So it's different from a benign tumor, benign growth, right? A carcinoma is actually cancer, and it's something that spreads. Okay, so carcino means cancer. Okay. Moving on, cautero, like cauterization. When we cauterize something, when a doctor, a surgeon is cauterizing something, what are they doing to it? They are actually burning it. Okay, so when some tissue is removed, sometimes cauterization is used to stop the bleeding of the area in the area. So some surgeons have tools that will cut and cauterize at the same time. So there's essentially no blood being spilled at that site, which is really useful when you are working in really small areas. You're trying to use really fine movements to remove tissue. You don't want a bunch of blood in the way, right? So cautero means burn. Moving on, chemo, like chemotherapy. Now, chemotherapy is not the same as radiation therapy. Of course, radiation therapy uses beams of radiation, like really concentrated beams of radiation that kind of pinpoint a tumor and work to reduce the size of a tumor. Chemotherapy uses chemicals in the body, and these are typically poisonous chemicals. So that's why chemotherapy can make somebody pretty sick, but it also works to destroy the cancer cells in the body. So kind of a trade-off. It's like, yeah, you're pumping me full of poison, but it's killing the cancer, which is going to, harm me in some way. We do chemotherapy for a reason. So chemo means chemical. Okay, moving on. Cryo. It's what I do when my kid wakes me up at 6 a.m. every morning, because he's a morning person. The second he wakes up, everybody has to wake up. Anyway, cryo, like cryotherapy. Cryotherapy. What do we do when we're using cryotherapy? We are using cold, right? Cryo means cold. So cryotherapy, cold therapy. You're using low temperature in some sort of treatment. Okay, so I'm an old man. I just hurt my back really bad a few days ago, shoveling snow out of my driveway. I listen. Everybody says lift with your leg. I wasn't even doing anything, and I felt a couple pops in my back as I just like used the shovel to I wasn't even lifting. I was just collecting, and a couple pops in my lower back. My back does not feel awesome right now, but I used cryotherapy pretty much all day that day. I didn't move. I rested it. I kept my leg elevated. It definitely messed with my sciatic nerve quite a bit. So I used ice on my lower back. It is feeling a lot better. I can actually move pretty well now. I'm still not going to the gym or riding my bike like I normally would. But I used cryotherapy, and I think that helped to reduce the amount of inflammation. In oncology, we can use cryotherapy to freeze things like tumors that can help us remove tumors, right? So cryo, cold therapy. Anyway, I go off on tangents. I apologize. And moving on, histology. I think we already went over this one a little earlier. So histology means tissue, right? So we're studying tissues with histology, and with oncology, you can do stuff like biopsies, where you're surgically removing some tissue and putting it under a microscope to get a view at it, see if it's normal tissue or see if it's something cancerous. I've had a biopsy done. I have this little spot on my arm. You can't even see it, but it's like a red spot. It looks like scar tissue. So I had a dermatologist do a biopsy, just kind of scraped off a little bit of skin, threw it under a microscope. He figured out that it was scar tissue. So I'm like, yes, I'm aware it's scar tissue, but why is it there? I guess he just wanted to make sure it was nothing serious. Dermatologist. Anyway, I digress. So histology, study of tissue. Moving on, so like mutation or mutagen. When we go through a mutation, when we experience a mutation of some sort, we are experiencing a genetic change. Okay, so there is a change genetically on the genetic level. DNA is altered in some way when we experience a mutation of some sort. Okay, so it can be through exposure to things like radiation that change our DNA, long-term exposure to other things like certain chemicals can change our DNA. Even just how we live can change our DNA in some way. It's how evolution works. So, the body's DNA changes a little bit, depending on, based on the experiences a person is having and what they're exposed to. And the body's always trying to find a way to kind of evolve and become better in the future, in future generations. Okay, so eugenic change. Just think of mutagen. Think of the Ninja Turtles, right? They were exposed to the ooze, which is a mutagen, which changed them on the genetic level to become the Teenage Mutant Ninja Turtles. Donatello is the best Ninja Turtle. Don't at me, as the kids say. Not up for debate. Anyway, moving on. Like oncology. Well, oncology is the study of. It's not cancer, right? Cancer is different than oncology. Onco means tumor. Okay. So in some cases, Arnold might say it's not a tumor. I'm not going to do an Arnold impression. I'm sorry. I'm not going to do that. It's not a tumor. In this case, it is a tumor. Onco means tumor. Oncology is the study of tumors, not necessarily cancer, because we can have tumors that aren't cancerous, but we can also have tumors that are cancerous that become stuff like carcinoma, a cancerous tumor. Okay. So oncology is the study of tumors. Moving on. Like a sarcoma. Okay. So we have different types of cancer that affect different tissues in the body. Okay, so a sarcoma is a tumor that specifically affects connective tissue. So sarco means connective tissue. Okay. So the stuff like bone, a tumor that would affect a bone would be some sort of sarcoma. Okay, as opposed to a regular carcinoma like you might find in the skin, like basal cell carcinoma. Okay, so sarco just means connective tissue. You see this. If you see the term sarcoma, you know that it's a type of tumor affecting a connective tissue. Okay, and I think that just about wraps up oncology word roots.